Suicides are on the rise in almost every state across the country.
The stigma of mental illness is you don't talk about it.
And that brain sometimes I feel like does betray me or tries to turn against me.
Celebrity chef Anthony Bourdain was found dead in a French hotel room this morning after taking his own life.
Half of the country has seen a more than 30% increase in suicide rates.
We didn't expect it, didn't see it coming.
This is part of her suicide note. She was sorry.
It's never just one thing that causes a suicide.
Police say there were signs pointing towards marital and financial issues before her death.
You just don't get better by saying, I'm going to get better.
You know, if we would have talked about it back then, and maybe he'd be here.
Oh, good evening and welcome. It is a topic that many are afraid to talk about, others embarrassed or ashamed. But tonight in our Town Hall special, we are breaking the silence on suicide. Thanks for joining us. I'm News Channel 3 anchor Andy Dominiani. Suicide rates have increased so much in recent years that the Centers for Disease Control and Prevention now classify it as a public health problem. New research shows suicides are on the rise in nearly every state. And in fact, in Michigan, the number of people who have died by suicide jumped 33% from 1999 to 2016. The CDC reports that in 2016, nearly 45,000 people took their own lives, and more than half of them had no known mental health conditions.
A lot of people assume that if it's happening in your brain, you can change the way you think or snap out of it in some way. But that it's a chemical imbalance that needs to be addressed, not something that we can just snap out of.
And so tonight we're going to take a hard look at how we got here. What is driving this devastating trend? We'll talk with doctors, also crisis counselors, prevention advocates, and families who've lost a loved one to suicide. Our goal tonight is to help you identify the signs that someone you love may be struggling and give you the tools that you need to help. We'd also like to extend a real lifeline to anyone who might be depressed or having thoughts of self-harm. You don't have to face this alone. There are trained crisis counselors available 24/7 to answer your questions, offer resources, or simply listen. Griffin Place is a great place to turn in the Kalamazoo area. You can reach somebody right now by picking up the phone and calling 269-381-HELP. Again, 269-381-4357. And if you're not in the Kalamazoo area, the National Suicide Prevention Lifeline is always open as well. That number is 1-800-273-TALK, 1-800-273-8255. We also want to join the prevention conversation in this hour-long broadcast. Send us your thoughts and questions on social media using the hashtag #SuicideHelp. Now, to work toward solutions in the suicide crisis that really is affecting all of us nationwide, we do want to talk about the problem itself. Joining me now to talk about that, our suicide awareness advocate, Susan Brown. Thanks so much for being here. Also, Dr. Perry Westerman, and thanks to you as well, Dr. Westerman. This is a tough topic, isn't it? That it doesn't come up in casual conversation, that does make people uncomfortable, but it is so critical that we get beyond that, that we sit here and talk about suicide because it affects all of us in many ways. I know you both have a personal story. Susan, you were inspired to get involved because you had friends who lost their lives to suicide.
Yes.
Tell me about that.
Well, we had a longtime friend that I didn't really know that much about depression and suicide until our longtime friend, we found out that he had a nervous breakdown and he was like 50 years old, and then he came out and said, I have been depressed for a long time. He was unusual. And then in Kalamazoo, we had a really tight-knit group of friends, and Jim Field was the first one who killed himself, and then out of the blue came Tom Hardy. And when that happened, we decided, a group of us got together and thought, it just knocked us apart and said, look, we're going to do something about this. And so we started talking to people. A lot of people were interested. We had the University of Michigan came down and formed some kind of an association with us. We talked to them, had a dinner for fundraiser, and really, I guess what we felt was, what we learned, and also I have to mention David Dunstone. He's a psychiatrist here. He somehow we got a hold of him, and we decided that we were going to do something about it, that the stigma really killed Tom Harding. And
when you say that, you mean he wasn't willing to discuss it
he
or
didn't,
seek help?
Nobody seemed to know any, none of us had any inkling that he was depressed.
Yeah.
And when he took his life, it was a shock.
I'm sure it was.
And then we felt that we could and kind of had an obligation to do something about it. And so that's where I got involved, was feeling.
Yeah, you got involved with what's called the Kalamazoo Collaborative Care Project. Dr. Westerman, I know that you're the medical director of that. Can you tell us what it is?
Well, the Kalamazoo Collaborative Care Project, Andy, is a program that has been started with the primary care clinics here in town, both at Borges and Bronson.
Okay.
As was mentioned, we all got together, and Dr. Dunstone was my predecessor. He's now retired. And so I picked this up from him, and we've started working now with the primary care clinics in Kalamazoo, bringing mental health services more formally into there. As most people who go to primary care doctors know, they will have a interview scale that they're asked at the admission. Are you feeling depressed? Are you feeling down or blue? You know, have you lost interest? And in that, then they go back to the primary care doctor and will identify, you know, is this something that we need to address? So most people go see their primary care doctor at least once a year. And so in that sense, there's an opportunity for us to then identify and intervene with people, with the hope being that as we treat depression and anxiety, we're also going to identify and treat the suicide risk.
Yeah, because a lot of people aren't willing to go see a specialist. They certainly aren't interested in going to see a psychologist or a psychiatrist. So primary care, where we're all willing to go, at least we have to once a year, that's really the critical place where these warning signs could be identified and quick action could be taken. And Susan, that would have helped certainly your friends, I know.
Yes, it would have definitely, but the stigma was so strong that they just chose to keep it to themselves.
Yeah, Andy, I would say that 50% of people who primary care doctors say you need to go see somebody about this never follow up because of the stigma. So meeting those services where they're at with their primary care doctor is a really advantage that we want to now pursue.
You know, we're talking about this now, and I'm so glad we are, when you hear about Kate Spade, Anthony Bourdain. These are outwardly very successful people. I think they kind of lived dream lives. And now we're all wondering what in the world was happening in their heads. Why weren't they happy? I certainly would be if I were them. Well, that isn't the case. And you can't always tell if someone's depressed or suffering by the image that they project to the world, can you, Susan?
No, it's really a disease of the mind. That's what we call it, is a disease of the mind.
Right.
And instead of saying committed suicide, that sounds like it's a really something, you broke the law.
Yeah.
It's take your life is what we are looking at. But the stigma is a very definite problem.
The emotional pain is a real significant issue. If I've talked to lots of people who have attempted suicide, and some that eventually were successful, and what they tell me is that emotional pain at that moment is intolerable. And if they begin to believe that this will never change, they start to see suicide as a better option. And so many people will have a distorted view of what's valuable in life, but that moment when this happens, they're feeling very lost and very struggling. And this is why suicide hotlines work so well, because if we just slow down the process and give people an alternative, they might take it.
Hopefully the Kalamazoo Collaborative Care Project will change the direction of some people's lives and save some lives. Dr. Perry Westerman, Susan Brown, thank you both so much for being here. We have lots more to talk about tonight, but I really appreciate your special insight on this. You know, no one really is immune to suicide, but there are some groups who are more at risk than others. According to a 2016 study by the Department of Veterans Affairs, on average, 20 military veterans die by suicide in the U.S. every single day.
I had spent a year in Iraq, from ages 18 to 19. My job involved photographing of mass graves. And it haunted me in ways that I couldn't understand and I didn't have the vocabulary to describe.
These men and women, you know, they volunteered to defend our freedom and they've been left behind.
Well, former VA Secretary David Shulkin made veteran suicide his top clinical priority for those completing military service. In January, President Trump signed an executive order calling for an action plan to address that issue.
The Joint Action Plan will describe concrete actions we must take to ensure every single veteran who needs mental health and suicide prevention services will receive them immediately upon their separation from military service.
Now, young people and especially teenage girls are also at an increased risk of suicide. In fact, the Centers for Disease Control and Prevention says that suicide is now the second leading cause of death in people ages 15 to 24. Their lives have not begun yet. Earlier this year, the American Academy of Pediatrics recommended that every child 12 years and older be screened for depression and anxiety at least once a year.
We are a safety net for our children. We need to be able to be vigilant about this. Screening is a way for us to make sure that we don't let these children fall through the cracks.
Now, earlier this month, New York and Virginia became the first two states in the country to pass laws requiring mental health education in schools from elementary through high school. Earlier this summer, Kalamazoo Public Schools approved adding 9 more staff members to help students there cope with mental health and social issues as well. Now, new statistics compiled by the Trevor Project say that lesbian, gay, and bisexual youth are almost 5 times as likely as heterosexual youth to attempt suicide. And those numbers increase again for LGBT students who experience rejection from their families. Well, calls to the National Suicide Prevention Lifeline jumped more than 65% just following the suicide deaths of Kate Spade and Anthony Bourdain. Those crisis counselors are available 24/7 for anybody in need. News Channel 3 anchor Kate Tillotson is live now at Griffin Place talking about some other resources that are available. Kate.
Yeah, Andy, we're live here at Griffin Place, and we're actually inside the call center. And as you said, these lines are open 24 hours a day, 365 days a year. They are never off. They are always turned on. You can see behind me that there are a handful of people answering the phones. And this is a pretty typical shift here at Griffin Place. On any given shift, there are about 5 people answering the phones, and all are trained in suicide prevention. In 2017, there were about 40,000 crisis calls here, about 90,000 211 calls, and every call is confidential, and it's handled with respect and professionalism and compassion as well. The Griffin Place was started in 1970. For those of you who've lived in the area for a while, you may recall that it used to be located closer to downtown Kalamazoo in the Vine neighborhood. Well, in 2011, it found itself in need of better technology and a larger space, quite frankly. So 7 years ago, they moved to their current location here on 8th Street, right off of Stadium Drive. I want to ask the Director of Clinical Operations now, Kristen Smith, to step in and talk to us a little bit about the programs offered here at Griffin Place. Kristen.
Yeah, thank you, Kate. Griffin Place has been around for 50 years almost, a crisis line for just about as long. So we have been accredited by the American Association of Suicidology for 40 years, answering calls 24/7. We're here all the time, and I always encourage people to call 381-HELP whenever there is a need for immediate crisis intervention or emotional support. We also do suicide prevention in the schools. Middle and high school students, about 4,000 students trained each year in suicide prevention, knowing the warning signs, reducing mental health stigma. So we have a lot of really great programs. We also have a Survivors of Suicide support group. So for anyone who's survived a suicide loss, they're welcome to join our support group and just connect with other people who have been through what they've been through.
You say you staff 5 people to answer the phone lines here. How busy are you? Are people consistently calling in?
Yeah, I would say, 100 crisis calls a day, maybe 500 through our 211 line, which is our information and referral lines. So we stay pretty consistent.
Okay, Kristen Smith, thank you for being with us, and we're going to check back in with Kristen, ask her a few more questions coming up later in the hour, but we are going to be with you throughout the 7 o'clock hour, and we invite you to be a part of this important conversation. We'd love for you to send us your questions for Kristen and for the folks here at Griffin Place online on our social media platforms. We'll be checking that and monitoring that throughout the hour. Please use the hashtag #SuicideHelp. And that way we'll be able to find your questions easily and get them answered. Andy, back to you.
All right, Kate, thanks. And we'll check back in with Kate here in just a little bit. You know, suicide is, of course, just devastating to the loved ones left behind.
Nobody understands how you feel about death by suicide. You can lose a child in a car accident, and not that that's any less, but it's a different feel to it when you know that your child wanted to die.
Now, coming up, we're going to talk to several people who have lost a loved one to suicide about how they're turning their tragedy into a passion for helping others.